We're sorry, the Rehab Institute over in Allison Park.
And I'm Kaitlyn, a recently licensed physical therapist. I was actually a student a few months ago, so very happy to be here with you all.
All right, so we're going to get started with our presentation. First, we just wanted to put a disclaimer up here. The information provided in this presentation is not intended to be a substitute for diagnosis or treatment for specific impairments. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding illness or injury. So just an introduction, all about the back here. So most back problems are actually not due to any serious injury or disease. About 80% of people who will experience low back pain in their lifetime. So a lot of people do experience this. Is very common. A lot of aches and pains can't last for a long period of time. And about half people with back pain have it again within a few years. And a lot of times if you're not seeking care and you frequently have it on and off for years, typically as time goes on, the pain does tend to get worse. So what you do in the early stages is very important. Resting more than 1 to 2 days is usually not helpful. If it's like an acute onset of low back pain, resting for more than that can be helpful. But anything after a week, I usually tell people, go get care. Really follow up with a doctor or physical therapist. So you can follow up with your PCP, an orthopedic doctor, physical therapist, life and motion, gym, personal trainer, exercise classes, or just doing exercise at home if you feel comfortable doing those things. Your back is designed for movement, and those who cope the best with back pain are those who stay active. Okay. So the nature of low back pain, a lot of times what happens is it's just compensation buildup over time, and then all of a sudden you have this onset of back pain or buttock pain or even radiating leg pain down into your foot. There are nerves that connect from the back all the way down into the foot, which is why you can have some of those symptoms. But basically you're compensating in some way with your daily activities, and that's usually due to a muscle weakness, a flexibility issue, or a mobility issue, just meaning the joints aren't moving the way that they should. So this kind of goes into like other diagnoses here. So like a disc herniation, an entrapped nerve, or like along with sciatica, or disc herniation meaning more so like a bulging disc. And some diagnoses related to aging are more so like arthritis, spinal stenosis, degenerative disc disease. I'm sure you guys have heard some of these before. So we'll go a little bit more into the ones that contribute to age. So age does play a role. You are at increased risk for low back pain if you're 55 years or older. And typically aging is also associated with decreased activity levels. So a lot of times what happens with the aging process is the discs in the spine dry out. So just like as a visual here, basically these are like your lumbar vertebrae. And these are like the spinous processes of the vertebrae. And then in between each vertebrae sits these discs. So like a degenerative disc disease just means over time, these jelly-like discs that are kind of used for like shock absorption with your daily activities get smaller and smaller and they dry out. And then that brings the bones actually closer together. There's not as much space within the spine, and that can increase stiffness and pain in the back. So then arthritis is more so like bony buildup within the joints themselves. So a lot of times you can see some bony buildup within the canal. You can see a narrowing of the canal that the spinal cord runs through, and that's more of like your spinal stenosis. And that's typically a very common diagnosis with age. So with that, again, it's decreasing that space, which can then impair your movement, it can increase pain. And then over time, like with aging, you just get muscle weakness, right? So if you don't have that core and hip support in the back and the pelvis, you're just not able to move as well. You're not able to complete your daily activities as well. The other thing I wanted to talk about with this is posture. So posture over time is like a very huge thing. So what tends to happen in the mid back is you get like a little bit of a hunch here, right? But then to compensate for your posture so you're staying more upright, your low back actually has to arch this way. And then same thing with your neck. And as you can see, with that, it actually closes down the spacing within the neck and the back, which can put a lot of pressure on the nerves, which can then send radiating pain down the legs. So risk factors associated with low back pain, and the good news is these are modifiable. So these are things that you can actively change. So big one, stress, anxiety, and depression are all related to increased pain, specifically low back pain. Physical inactivity, smoking, poor care for associated comorbidities, diet, understanding the health and nature of low back pain, and then falls. So just to go into a little bit more with stress and anxiety. Stress and anxiety can increase muscle tension, inactivity, and this increases hypersensitivity, which then can in turn increase pain. And it has like an inverse reaction. So low back pain can increase stress and anxiety can increase low back pain. So how do we address this? So first, just getting a better understanding in the nature of your low back pain. And then you want to modify your activity as needed in the early stages. You don't want to be pushing through high pain levels with this, because usually that just tends to make it worse. You want to gradually increase your activity level once you're able and that pain goes down, and then incorporate a strengthening program based on individual needs. And that's a lot of times where like we come in as physical therapists, or as like Life in Motion has exercise classes and all that kind of stuff. Or following up with your doctor if you need to do that as well. So like I said, the biggest thing is getting here early, seeking professional care if you're unable to manage this type of pain on your own, and then also staying active. You have to do the work and you have to be consistent with your exercise programs. Usually I tell people 6 to 8 weeks of a consistent program is really when you're going to see those significant changes, because that's how long it really takes to get muscle change and strength and flexibility and mobility changes in the spine. Okay. So inactivity, just to go into that, leads to weaker bones and muscles. It can increase stress, anxiety, and depression. It can decrease physical fitness and endurance, increase blood pressure, and then worsen pain and increase stiffness.
And going into some of the benefits of physical activity, we have decreasing your blood pressure, decreasing stress, anxiety, depression, increasing those happy chemicals in your brain has a carryover there as well, decreasing your pain, improving physical fitness, strengthening your heart and lungs, strengthening your muscles, and decrease stiffness overall. And I have this picture of a road on here to tell you to keep moving. Everyone's path with low back pain is going to be a little bit different. Others might have more curves in the road, steeper hill to get over to decrease that back pain. But the most important thing, keep going on that road and make sure that you keep moving through. And then I'm giving you some types of physical activities. You have walking, swimming, biking, exercise classes, dance, yoga, and strength training. But the biggest thing with all of this is to really do what you enjoy. If you're not someone that loves to go swimming, probably not going to be as involved in that over time. But if you like to walk with friends or like the idea of a group class, and if you're like the motion, staying active is very important. So you should be doing what you love. And then on this side, we have some pain guidelines for your physical activity. A general rule of thumb on that 0 to 10 pain scale, if you've been in PT before, you're very familiar with this scale. But if that increases by 2 points or more on the scale, either during or after activity, it's recommended to modify that activity or hold off on it overall. And then just some scales here. Low levels of pain are typically rated 0 to 3, moderate 4 to 6, 5, 7 to 10. So if you're getting into that unhappy face range, red alerts, usually a sign to modify the activity or rest a little bit as well. A big factor in protecting our back is core and hip strength. Those core muscles are going to be the primary stabilizers all around the spine. They help in protecting the spine and reducing stiffness on lumbar vertebrae and discs, like Sarah showed with the model here. Additionally, hip muscles are the secondary stabilizers for the spine, and when they're weak, we can have improper transfer of forces through the hips and the spine as we go through. And the spine can take on increased loading during functional activity due to compensations for hip weakness during movements. So it's really important to strengthen and address deficits down the chain. Even though low back's the main problem, we want to strengthen it above and below as well. And then deficits in the hip knee and ankle, strength, flexibility, or mobility can lead to poor body mechanics, which leads to that increased low back pain. So getting a little bit into more what we'll demonstrate in practice today, lifting and some risk for low back pain. So you might be wondering, why does my back hurt when I'm going to pick items off from the floor? Lifting mechanics can play a role, and we're going to go over that today. But like we've been talking about this whole time, lack of appropriate core and lower body strength and endurance plays a factor as well, so that's why it's really important to keep moving. And then from there, how can I decrease my risk of low back pain? Movement, like we talked about, aerobic activity like walking or swimming, like strength training, and avoiding sitting for prolonged periods all have carryover into those more functional activities as well. And then being aware of how you're lifting, which we'll practice in just a few minutes. So some things to consider with proper lifting mechanics is preparation. If you're looking at the object, is it something that you can lift up on your own, or would you need a second person to come in and help you? Is the path that you'd be carrying the object through clear? Is there anything on the floor, laundry, groceries, anything like that going to block your way? And then wherever you're carrying the object to, is that clear as well? Say you're going to put it on the counter. If there's things on there and you have to move it while you're holding the object, that could lead to increased risk for injury. And then we have a few things listed here, and it would be helpful to think about these as we're practicing for safe lifting guidelines. These should be roughly shoulder width apart, with one foot slightly in front of the other if needed for balance, and you can work through that together. Bending at the hips and the knees, less so through your back. Maintaining your back in a more straight position while engaging your core. Using the large muscles in your legs to raise you from the floor rather than just bending at your spine. And then keeping that object close to you around waist height, and avoid twisting while you're carrying the load. And then remember those same mechanics, just in reverse. So you go, stand back up. And then here's just a little visual of what we don't want you to do when lifting an object from the floor, and those proper mechanics as well. And then we're going to demonstrate a little bit for you as well. But before we get into that, does anybody have any questions?
Well, I can't bend my knees.
We have some modified techniques.
Okay, good.
Absolutely. Yeah, we'll go over those as well. Yeah. Anything else? Okay, awesome. So what we're going to do is I'm just going to have Kaitlyn demonstrate some of the techniques that we're going to go over today. So if you guys want to flip to your lifting technique page. Yeah, let's move this back a little.
A little light.
Yeah, that would be great.
We don't need all of it, I guess, but.
Step one, clearing your pathway. Don't want to trip over cords and wires.
All right, so the first technique is more like your power lift. So this is where, this is for things that are actually a little bit heavier or things that you can't just pick up with one hand, that kind of thing. So basically you're going to get as close to the box as you can. And then you're really going to use the legs here. And see how Kaitlyn's back is like nice and straight. You almost want like a hip hinge versus bending that back forward. Because bending the back forward and twisting, especially with a load, are the two most vulnerable positions for the spine and put you at increased risk for injury. So I know it's very easy to just kind of go like this, pick something up off the floor, right? But you want to make sure that you're really keeping that back straight, sitting back like you're sitting in a chair, and then same thing when you go to put the box back down. Very good.
Don't want bending forward at those hips, using all those back muscles only.
I did it all
Stand
this
back
morning. I
up.
had to lift 5 boxes and go up 5
Yep.
steps to the upstairs.
Yep.
Set up like for pickup.
Right.
And I did it all.
We all do, it's just taking that one extra second, stop and think about it. We can practice that a little bit today.
Yeah, half the battle is
Well, my back hurt. Probably I wasn't doing it in favor.
right, right. And
It only
that's
takes one time for you to do it wrong
Right.
and you feel it.
And kind of like we talked about before, like those compensations building up over time. If you're constantly doing this over and over, there's gonna be one time where your body's like, nope, not anymore, and it's gonna be in pain with it, and you don't know what time that will be. So if you take measures to like just be mindful about how you're lifting things and, you know, be preventative with it, then you're putting yourself at decreased risk for injury, decreased risk for pain.
And you mentioned if you had to turn as well, or are you guys gonna go over that, like,
We are.
okay.
So next thing I'm actually gonna have Kaitlyn do, I'll have her just lift this laundry basket actually. Okay. So say you're lifting laundry basket off the floor, she's gonna get as close to it as she can. She's going to sink down, pull it up, keeping it close to her body the whole time. Now, she's not actually going to twist. If she has to set it down, she's going to turn her feet.
1 foot at a time, make sure you still have that sturdy one as well, so then walk in opposite direction.
So see how she turns versus twisting of the spine? Okay, so it's very important.
This, want the whole body to stay as one.
Absolutely, and then same thing when you go to put it down. And it is a little bit more time consuming, but just being mindful about it is super important, is half the battle.
Especially if a history of low back pain.
So if
Absolutely.
you can have handles on something like my box, if it had handles on this one, I
Right.
had to go up and meet the box.
Right. And that's where it gets a little tricky, right? Because not everything is a perfect box with handles on it.
That kind of moves us into our next technique as well. So something like this, with the box. Sometimes you can kind of get 1 foot in front, even if that means kneeling down as well, so you have a little bit longer of time. Say this was a heavier box, not empty with all of our Amazon packages, really getting those hands under there, still bringing it close, pushing.
And that's why it's good to do a strengthening program, because you really need good leg strength and push up with one leg, right? The second thing is not everybody can kneel, right? So this may not be a technique for you if you're not unable to kneel. If you are able to kneel, always on a soft surface. So pillow, cushion, bring it with you, set it up before you do the actual lifting. Kind of like the prep that Kaitlyn was talking about earlier. Okay, so this is more so for like lighter objects, that kind of thing. Now, say you have difficulty with knee bending, it's very hard for you to like push up on one leg. There are a couple other techniques that we can do. So let's just go over hip hinge first. So we'll do that without a box. So basically, if you can't get a whole lot of knee bend and actually squat, this next technique is probably going to be more so for you. So again, you want to get as close to the object as you can get. You want to tighten your core. You can keep a slight bend in your knees, and then you want to hip hinge forward. So again, back is straight, head is in line with the spine here, right? And then you can pick up off the floor that way. But you really just want to avoid that like bending of the back like this, right? Versus this, right? Where you kind of like stick the butt out a little bit, keep the spine nice and straight, and get as close to the object as you can. Another variation of that is more like a golfer's lift. So let's just use like, yeah. So this is kind of like the second technique that we did with the lunge.
This would be another one for smaller, less heavy objects.
Absolutely. So just standing on one leg, and again, probably if you need, like say your balance is a little bit off, it's hard for you to do something like that. See if you can get somewhere where you bring a chair, you can bring a chair up to the object, and then use one hand, you can go down and pick up. And you're never actually lifting that leg up, right? You're just sliding back, grabbing the object, and you have this hand for support, you know, if you need it for that balance. Does anybody have any questions about any of the techniques so far?
I'm just usually pain.
Yeah.
Not in my back, in my knees.
More in the knees. Yeah, would it be something that you'd like to try and see? how it
Oh, I'm
feels?
definitely going to try.
That's
Yes.
great, okay, yeah, because I think trying is gonna be the best way to figure out what technique works best for you. And we know that like, you can't use this technique, for every single thing that comes up. But the best thing to do at that point, I think, would be to maybe ask for help, get a second person in there to see if they can help you, especially if it's something that's like a heavier object. Yeah.
I would just like to say, please, and I'm sure Becky will say this about one-on-ones and different classes, but I know that when I'm setting up my classes, I deliberately put those actions into a class. Whether I do it at the bar, I do it in multiple ways, multiple objects or no objects, weight, no weight, just the body weight. Just really deliberate. It's just one of those daily activities, and we work on it in like fashion with double leg lunging. So working on keeping the back upright, keeping the back flat, or so maybe I'll see you in class one day. But it's
When I'm
very,
done with physical therapy.
yeah,
Yeah.
but it is very deliberate. It's just one of those bend and lift. It's like an umbrella.
Yeah, like a category to,
Absolutely.
and building that body awareness is just key.
Yeah, absolutely. And that's why, if you feel like you're having a lot of difficulty with these things, it may be good to seek professional help about it. Whether you go to physical therapy and that's what you spend your time working on, or you come to Life in Motion and take classes that are specifically related to this kind of activity. I think all those things are good. Just having a little bit more knowledge about it as well, I think is helpful.
I feel like the more you do anything, the more you'll get better and
Absolutely.
safer.
Practice makes perfect.
Yeah,
Yeah.
and strengthen up all the muscles needed to do them, like they were saying.
Absolutely. Does anybody have any other questions before we get into the practice portion of our?
Does anyone have any other troubles with bending and lifting and things?
Yeah, like getting up off the floor. Yeah, and I think that has to do a lot with like strength. And that's something that, we can definitely help out with if that's something you're willing to do. Whether it be just getting some home exercises or coming in or, taking a class, anything like that, I think would be beneficial.
Yeah, because some of the same moves will help you get all the way down and all the way back up too, than just picking something up off the floor.
Absolutely. Absolutely.
Does footwear, is there better or worse? I assume something stable, but like bare feet, slipper, does it matter, I guess, with
when
what you're
you're
lifting? Yeah.
In particular, I think it would be better to have like more supportive footwear on than, when you're lifting versus, doing barefoot or in socks.
So
I think there's
sometimes,
some
yeah,
pieces.
around the house, you never know what you're
Absolutely.
wearing.
Especially if you have any sort of anything like diabetes, peripheral neuropathy, those kind of diagnoses, it's very good. Like you don't have a lot of feeling in the feet or anything like that, not to just be in like your bare feet doing.
That means too, if you're carrying something around the house, if you have more sturdy shoes on instead of slippers or something like that, one less thing to worry about as you're walking with a heavier object as well. That's something that you can focus more on, those mechanics of holding and potentially tripping over any obstacles or your shoes on the floor.
I actually, I can't carry a basket, I can't do it this way. If I can put things on the side, I can do it easier than trying to put it directly in front of me.
Yeah, I'd say the biggest thing with that is just watch you're not twisting as you're carrying
Yeah,
it.
so you're saying it's more like this?
Yeah.
And you're walking with it?
Yeah.
Do you have a cane?
I don't carry many baskets, but I know that I can't carry anything in front of me like this.
Is that because it's blocking your feet?
No, it's, I think just the, this one here, so that I can't. I don't know.
Yeah. Or maybe
Awkward.
we can take a look at it more so when we practice, just so we can see what the real issue is there.
We'll throw out some weight in that basket. No, I'm just kidding, Barb. I wonder too, like the good idea of like having a chair nearby too, if it's like do it in steps, like what if you had something and then set it on the chair, reset, and then get from the chair and then go,
Correct.
if you need to break it down into.
Absolutely, so you don't have to do it all in one motion, like Jackie said, that would be the safest, and even though it is more time consuming, it in the end is more efficient and protects you in a better way.
I would have to box, you know.
Yes.
Feel and boxes up.
There you go. But we'll try with some like very light stuff today and just see how it feels for everybody. So is everybody ready to do some practice?
Woohoo!
Great.
Yeah, okay, great. So we'll just get a couple things out here. I think maybe we can start with like the crate and the laundry basket.
If we need to grab any other, we can even empty that basket.
Like this one here.
Mm-hmm.
Yeah, this one.